Hi everyone, I'm Dr. Nina, high risk pregnancy specialist. I'm here to share some tips and tricks about the right amount of nutrition to be taken during pregnancy or the healthy eating in pregnancy. Is it true that we need to eat food too, or is it a myth? Yes, of course, it is a myth. It's not eat food too, it's eat twice as healthy, which is to be done nowadays. When we think about pregnancy, we feel that we are growing a baby, so we need to provide adequate nutrition to cover the growing demands of the baby. It's not like that. During pregnancy, maximum which we need to supplement is only additional 300 calories, which may be equal to a glass of milk and a half slice of sandwich. But definitely, if you eat food too, you will have an increased weight gain during pregnancy, and it can invite complications during pregnancy like increased chance of having high blood pressure, which is a preeclampsia, early delivery, which is a preterm birth, as well as increased risk of developing diabetes in pregnancy. Also, when baby is born, baby will have a big size and it can cause childhood obesity and other complications. So eating in the right amount, in the right time, and the right food, that is what is very important. When I talk about the right time, it is not like a particular fixed time you need to eat the food. Yes, of course, when you're hungry you can eat, but it's always advisable to cut your food or divide your food into five portions. Whenever you are hungry, in between you can take or consume a fruit. Very importantly is the right amount as well. As I mentioned, 300 calories additional is required, and that too the right amount of the carbs, proteins, fats, vitamins, as well as minerals. The carbs, when you take about the carbs, just take the right amount and don't take too much. Proteins, any protein in the form of lean meat, eggs, poultry, as well as pulses are okay, but very importantly, when you take the meat as well as the seafood, it should be thoroughly cleaned and cooked. Always consume pasteurized milk, and try to avoid fish liver oil as it has got high levels of vitamin A, which can cause birth defects in the baby, especially when consumed during the first 3 months of pregnancy. And regarding the cooking as well as the cleaning, especially when you're dealing with the eggs, as well as the meat and the fish, the poultry, the chicken, everything, so that it helps to reduce the risk of contamination and also prevent the growth of the bacteria in the food and being transferred to the mom. The problem is the mom can get affected, have consequences. Also, some of these organisms can get transmitted to the baby, and that can cause birth defects, even especially infections like toxoplasmosis, which can get contaminated to the cats and the feces. So always important to have clean food and well cooked food. Try to avoid spicy, oily, and salty food, sugary foods, and try to take as much as healthy, balanced diet. There is one common doubt whether we can take coffee during pregnancy. Better to avoid caffeine in a large amount during pregnancy. Try to limit it to 1 cup of coffee per day, as caffeine consumption, though there is a no direct link with any adverse pregnancy outcome, but we are not sure, so better to limit it to 1 cup per day. Also, about the tea and other fizzy drinks, try to avoid the fizzy drinks and the other added sugar juices. About the tea, try not to take along with the calcium. Another very important thing is the intake of the folic acid, which is a vital vitamin to be taken and starting from the pre pregnancy period itself. It is a vitamin which helps to reduce the birth defects in the baby, mainly the spine defects, which is called as the neural tube defects. Ideally, to be started 3 months before pregnancy and continued for 3 months, first 3 months of pregnancy also. When you're carrying twins, it is not that you need to eat for three, it is eat thrice as healthy, which means maybe an additional 600 calories required, which could be maximum like 2 glasses of milk with 2 slices of bread and adequate amount of the protein. So there is another question. If you are overweight, is it advisable to have weight reduction during pregnancy? Can you diet during pregnancy? No, it is not advisable. The best time to do the weight reduction is before pregnancy. But during pregnancy, we usually advise for a limited weight gain depending upon your body mass index, which is the BMI calculated with your weight in kilogram and height in meter square. Ideally, the BMI should be less than 30 kilogram per meter square. For an Asian population, try to maintain it between 19 to 25. But definitely, if the BMI is more than 30, we don't advise for a weight reduction during pregnancy as it is not good for you as well as your baby. But instead, we can try to limit the weight gain during pregnancy with the help of a nutritionist and having a proper nutritional plan. Any other doubts on nutrition in pregnancy? Please let me know. Thank you.